The Pancreatic Cancer Collective is this amazing collaboration between the Lustgarten Foundation and Stand Up to Cancer.
We've picked an elite team of extremely intelligent and motivated individuals to try to crack a nut that nobody in the past has had a shot at.
Pancreatic cancer is one of the most aggressive cancers around. It's often discovered late.
It's a rare cancer. So one of the questions is there something special about the patients that they get this very deadly tumor?
We'd like to develop early detection methods that allow us to see pancreatic cancer very early.
I don't see how we can really change the course of pancreatic cancer if we can't figure out how to find those patients earlier and to treat them then, where we have a better chance of really basically curing the disease.
We put forward a proposal to identify a high-risk population for pancreatic cancer from clinical records that are available in health systems. And the challenge is to try to help the general population to identify pancreatic cancer early, or perhaps even prevent it. We're going to do something really ambitious that's not done yet. Rather than waiting for patients to come into the clinic with some pain and then getting a diagnosis for pancreatic cancer, what we're trying to do is to analyze clinical records from people's personal health histories over some years and identify, based on that, whether or not they're likely to get pancreatic cancer. The earlier we catch it, the better the chances are for being able to cure it or to prevent it. If it's detected early, 40% of patients have a 5-year survival probability, and that's good, but it's not good enough. We want to catch it even earlier, and that's the goal of the research.
I'm very excited about this proposal. This is really a very interdisciplinary effort. There are from medical doctors to basic biologists that are working on pancreas. We have a very different angle to look at this project. What we are proposing is integrating everything, getting information from the genome and information from the environment, in particular with this microbial component and this immune component, and then trying to see how these two systems interact. But by large, we don't know exactly what is special about the patients who are diagnosed with this deadly tumor. There are two types of hypotheses that we are following. One is mutations. Is there something in the genetic makeup of a person that can determine if this person is going to be susceptible for this particular cancer? And the second one, that is related to some observations, has to do with the immune system. Is the immune system playing a role in how these tumors and they are developing in some people or not? So we want to explore this question. And if we are successful in this quest, we can identify patients that can be at high risk for this particular pancreas. And also can tell us something about how these tumors develop. And hopefully, they can tell us something about how to prevent these particular effects. So my overall goal would be to get a complete understanding of these tumors.
We need faster progress, we need more effective treatments, we need to save lives, and the Pancreatic Cancer Collective is completely focused on that.
This is a quest. We have a set of explorers. I think having pleasure, intellectual pleasure, looking for something that is beyond ourselves is something that is very important for us.
It's very much research aimed to make new discoveries in attacking the problem of pancreatic cancer, which is such a nasty cancer. We think we can make a contribution both to individual health and also to overall healthcare costs.